Thank you, Dr. Mary Klingensmith, for talking to the Op Report about your observations in the changing interests of general surgery trainees. What have you observed?
Yeah, you know, I have a unique position in that I have worked in an academic medical center for the past 15 years. I'm at Washington University in St. Louis, and almost 100% of our graduates go into academic practice. We've had an explosion in the number of fellowships at WashU, as have many places. The majority of residents graduating from all training programs now, in excess of 80%, go on to subspecialty training. So WashU is not alone in the fact that we send people on to subspecialty training into academics. But what I've observed is that what this means is that there are fewer people going into general surgery. And if you read the literature about workforce, both current as well as projected workforce needs, we are facing a real dire shortage of general surgeons. The data on the economic value of a general surgeon to a community hospital is really striking. The presence of that general surgeon can be an economic driver, lots of downstream revenue issues related to the presence of that general surgeon. And it's actually cheaper to have a general surgeon who can do the breadth of operations than several specialists who do a small slice of that pie.
Right.
I also know it from personal experience. I'm the daughter of a general surgeon from rural West Virginia. My parents live in that same rural environment, and I know that they've had a lot of trouble in their community hospital finding people to replace my father, who now retired more than 20 years ago. But it's a real need out in typical America. They really need general surgeons. And
Absolutely.
Fortunately, as a surgical community, we haven't figured out how to get our trainees interested in general surgery. We haven't figured out a way to make it attractive. We haven't figured out a way to deal with the reimbursement issues. And I think it's a compelling concern that we all need to take on and figure out a way to solve.
Indeed. About 80% now nationally are going into subspecialties, and that leaves about 200 graduates in general surgery every year.
Correct.
Do you know how many retire every year?
Yeah, that's a great question, Chris. I don't know the answer right off the top of my head. I do know that the Shep Center at UNC that has been concerned with workforce studies has published quite a bit on this. And I certainly am aware that there's been some projections that there was a 25% decline over the past 2 decades, and a further 18% decline, I believe, is projected over the next decade in terms of numbers of general surgeons. So we're already working ourselves behind the 8 ball in rapid fashion.
Indeed. Are there, I do think I've heard of some new residencies arriving that are specifically aiming toward teaching rural surgeons. I want to say in South Dakota, North Dakota, perhaps?
Agreed. It's one of the Dakotas. I'm not sure which. You're absolutely right, and I think that's wonderful. There are some large programs. Oregon Health Sciences University, one of the largest programs in the U.S., does have a rural surgeons track. So they're able, in I think, a fairly unique fashion, to both train people for some of those important subspecialty positions, which I do think still have absolute relevance and importance. But I think we also need to pay attention to this other slice. So a program like OHSU, the new program in one of the Dakotas, Gunderson Clinic in La Crosse, Wisconsin, they too, the program in Cooperstown, New York, Bassett, some great programs that are turning out very well-trained surgeons to do general surgery. We need more of those, and we just need to entice residents to see that those are very viable and satisfying careers.
Yeah, I wonder if part of it is, I used to work as a rural surgeon in Oregon, in fact, and then moved to Phoenix, where I just had a much narrower slice. And I can imagine being a resident and seeing that a general surgeon just has a much less to do, and you know, the breadth of practice that I enjoyed in Oregon was, to me, would be more inspiring than what they saw in my training.
And I will submit to you that I think one of the issues that we have in my own residency program here is that we don't really have true general surgeons that our trainees are exposed to see that very large breadth that you described, that you experience in Oregon. They see a narrow slice that doesn't look quite so attractive to them. But there are lots of general surgery jobs out there that truly are that satisfying breadth of practice, and many that are in environments pleasant to live in, compensation that's really competitive, call schedules that are not onerous. So it exists out there. We just need to figure out how to train people to want to do those.
How to inspire them, right?
Right, exactly.
All right. Thanks again. Talk to you soon. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.